Welcome to Wally's Nursing Videos, your go-to channel for comprehensive insights into the world of healthcare and nursing. Today, we're delving into the intricate realm of chronic and acute neurological diseases, shedding light on conditions that impact countless lives. In this video, we'll take a closer look at some of the most prominent neurological disorders, including ALS, amyotrophic lateral sclerosis, GB, Guillain-Barré syndrome, MS, multiple sclerosis, Parkinson's disease, seizures, and myasthenia gravis. We'll explore their characteristics, causes, and most importantly, how healthcare professionals like you play a pivotal role in the lives of those affected. Join us as we navigate the complex terrain of neurological health, understanding, and care. Let's dive in! Here's a brief overview of the mentioned neurological diseases. Amyotrophic lateral sclerosis, ALS, often referred to as Lou Gehrig's disease, is a progressive neurodegenerative disorder that affects nerve cells in the brain and spinal cord. It leads to muscle weakness, spasticity, and ultimately paralysis. The exact cause is often unknown, and there is currently no cure. GB, Guillain-Barré syndrome. Guillain-Barré syndrome is a rare autoimmune disorder that affects the peripheral nervous system. It typically starts with weakness and tingling in the legs, and can progress to muscle weakness and sometimes paralysis. The exact cause is not well understood, but it often follows an infection or vaccination. MS, multiple sclerosis. Multiple sclerosis is a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. It leads to a wide range of symptoms, including fatigue, muscle weakness, and problems with coordination and balance. The cause is complex and involves immune system dysfunction attacking the protective myelin sheath around nerve fibers. Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder characterized by the loss of dopamine-producing neurons in the brain. It results in motor symptoms such as tremors, bradykinesia, and muscle rigidity, along with non-motor symptoms. The exact cause is multifactorial, including genetic and environmental factors. Seizures. Seizures are a symptom of various neurological conditions and can occur due to a wide range of causes, from epilepsy to head injuries and infections. They involve abnormal electrical activity in the brain and can manifest as convulsions, loss of consciousness, or other behaviors. Treatment depends on the underlying cause. Myasthenia gravis. Myasthenia gravis is an autoimmune neuromuscular disorder characterized by muscle weakness and fatigue. It occurs when the immune system mistakenly targets acetylcholine receptors at the neuromuscular junction, impairing communication between nerves and muscles. Treatment often involves acetylcholinesterase inhibitors and immunosuppressive medications. Understanding these diseases is essential for healthcare professionals in providing effective care and support to patients with neurological conditions. Each condition has its unique characteristics, challenges, and management approaches. Let's provide details on the mechanism of action, MOA, and specific side effects for the mentioned medications and drugs, as well as relevant information for the other topics. Understanding key concepts. Blood-brain barrier. The blood-brain barrier is a protective barrier that separates the bloodstream from the brain and cerebrospinal fluid. It controls the passage of substances into the brain, protecting it from harmful agents but posing challenges for drug delivery. Status epilepticus. Status epilepticus is a medical emergency marked by continuous or recurrent seizures without intermission. Treatment: immediate administration of a benzodiazepine, e.g., lorazepam or diazepam, is crucial to halt seizures. Subsequently, anti-epileptic drugs like phenytoin or levetiracetam are used for prevention. Medications for neurological conditions. Phenytoin, anti-epilepsy drug, MOA. Phenytoin stabilizes voltage-gated sodium channels, reducing abnormal electrical activity in the brain. Side effects. Common side effects include dizziness, drowsiness, ataxia, coordination problems, and gingival hyperplasia, gum overgrowth. Serious side effects may include rash, liver toxicity, or blood-related issues. Sumatriptan, used for migraines. MOA. Sumatriptan narrows blood vessels in the brain and reduces the release of inflammatory substances, alleviating migraine symptoms. Side effects. Common side effects are chest pain, tingling, dizziness, and a warm or prickling sensation. Serious side effects may include heart problems, high blood pressure, and serotonin syndrome. Mannitol, osmotic diuretic. MOA. Mannitol is an osmotic diuretic that increases osmolarity, drawing water out of tissues to reduce intracranial pressure. Side effects. Possible side effects include fluid and electrolyte imbalances, dehydration, headache, and nausea. Levodopa, used in Parkinson's disease. Levodopa is converted into dopamine in the brain, compensating for dopamine deficiency in Parkinson's. Side effects. Common side effects comprise nausea, vomiting, and dyskinesias. Involuntary movements. Carbidopa-levodopa, combination medication for Parkinson's. MOA. Carbidopa prevents levodopa breakdown in the bloodstream, enhancing its passage to the brain. Side effects. Typical side effects include nausea and dyskinesias. It can also cause confusion, hallucinations, and mood changes. Naproxen, non-steroidal anti-inflammatory drug, NSAID. MOA. Naproxen reduces pain, inflammation, and fever by inhibiting prostaglandin production. Side effects. Common side effects consist of gastrointestinal problems, high blood pressure, kidney issues, and an increased risk of heart problems. Combination medications for migraines. These typically combine a pain reliever, e.g. acetaminophen or NSAIDs, an anti-nausea agent, e.g. metoclopramide, and a vasoconstrictor, e.g. caffeine, to address different aspects of migraines. Patient teaching. Educate patients on proper usage and potential side effects of these combinations. Pyridostigmine, used in Myasthenia Gravis, MOA. Pyridostigmine inhibits acetylcholinesterase, preventing acetylcholine breakdown, which improves muscle contraction. Side effects. Common side effects include excessive salivation, abdominal cramps, and diarrhea. Overdose can lead to a cholinergic crisis, causing muscle weakness, breathing difficulties, and potential respiratory failure. Understanding these MOAs and potential side effects is critical for healthcare professionals to ensure effective care and safe medication management for individuals with neurological disorders. Thank you for joining us on Wally's Nursing Videos. We hope this exploration of chronic and acute neurological diseases has been enlightening and valuable to you, whether you're a seasoned healthcare professional or someone simply curious about these conditions. Remember, knowledge is power, and it's through understanding and compassion that we can make a real difference in the lives of those affected by neurological disorders. If you found this video helpful, don't forget to like, share, and subscribe to stay updated with our latest content. And as always, please feel free to leave your questions and comments below. We're here to support your journey in the world of healthcare, one video at a time. Until next time, take care and stay curious. Wally's Nursing Videos, signing off.